How much thought do you give to what goes into your mouth, what you eat, and what you drink? Have you also wondered what accompanies your groceries and food items from the market? In today's Friday special, Gloria Remo takes a look at the health hazards associated with the housefly.
There is no gainsaying that food is a prerequisite for healthy living, nourishing the body and supplying the needed nutrient for growth, strength, and overall well-being. In many markets across the country, food is often displayed in the open, fresh, colorful, and ready for purchase. But often unnoticed or simply ignored is a tiny intruder that compromises the safety of what is eventually consumed. Scientifically called Musca domestica, the common housefly may appear harmless, yet public health research shows it is one of the most efficient carriers of disease-causing organisms. Studies show that flies breed in decaying organic matter, refuse heaps, animal waste, sewage, and stagnant water. When they land on contaminated surfaces, pathogens cling to their legs and bodies and are transferred to exposed food items through contact, vomiting, and defecation.
Now, while these flies may appear insignificant, health experts say their movement from waste to exposed food is enough to transmit bacteria, causing serious ailments.
To better understand the impact of these flies, I spoke with a public health physician who explained some of the consequences of unsanitary food practices.
Unfortunately, most people are conversant with the acute. Acute is the immediate ailments that we see. Example is gastroenteritis. Gastroenteritis will present like vomiting, diarrhea, stomach discomfort and all that. And then you have dysentery. These are the acute ones. When you have the negative or the pathogenic bacteria, what happens? The GI tract, the intestine areas will open, and then toxins will now, from the gut area, will now enter the blood. From there, heart disease can come. From there, fatty liver disease. A lot of chronic diseases will come.
Foodborne diseases remains a major public health concern, particularly in densely populated urban areas. Children, the elderly, and individuals with weakened immune systems are particularly vulnerable to these diseases. According to UNICEF, over 10,000 cases of cholera were recorded in 2025, with 244 deaths, and children being the most affected.
One is pregnant women, of course. Why? We know pregnant women cannot take everything. The way you manage a pregnant woman is not the way you manage an average person. Apart from pregnant women, you have children. Children are like the canary in a coal mine. They are susceptible to quite a lot of things. Their systems are easily perturbable, So then we have the elderly as well. They are vulnerable. We have the sick. All these are vulnerable. So it means the environment should be clean, and they should, minimize exposure to house flies or having house fly perching on their food and all that.
In many markets, poor waste management and inadequate sanitation creates ideal breeding conditions for flies. According to the National Agency for Food, Drug Administration and Control, limited enforcement of food hygiene regulations compounds the problem.
Just look at the market, look at the environment, look at where the vendor you're buying from. Each vendor, some of the vendors don't, maybe because they want to evade payment of certain fees and all that stuff, and then they just locate close to a particular gutter. You know that there is a problem. If somebody is cutting raw meat, selling raw meat close to a gutter, is that not a problem? Looking at the raw food, like I mentioned, of course, you have to wash it very well. Some people use salt. Salt does not kill bacteria, but it can stop it from multiplying. Okay? Yeah. Some people use vinegar. Same thing. Vinegar could kill some bacteria.
While Lagos State government is working on making environmental friendly markets accessible, The burden of work lies with individuals.
I think I prefer buying from local markets because sometimes you have access to varieties and then they are likely most cheaper. First, I ensure that I properly wash them clean, sometimes with salt, sometimes with white vinegar, depending on if it's vegetables or tomatoes, depending on the food.
Ensuring that the food I'm buying, let's say perishable food to be precise, I ensure that they're still healthy enough to last about 2 to 3 days at home. That's aside of using the local storage facilities like a fridge.
The local market food is cheap nowadays. And once I bought it from local market, I parboil it. So, I think John Lonnie, I think John's okay here.
The presence of houseflies in the markets may be common, but the risks they pose should not be normalized because what settles on scene may have great consequences beyond the marketplace. Glory Aremu, TVC News, Lagos.